I am Dr. Dilip Dhanpal, Senior Urologist at the Sagar Hospitals, Bangalore. The topic today I will be speaking to you all on is enlarged prostate. Now, enlarged prostate is per se not a disease. It is a physiological change happening in every male person, which gives rise to certain symptoms, and most of these symptoms come after the age of 60 years. Sometimes rarely before 60, say maybe diabetics by the age of 55. But in general, it is the problem of the elderly. They have difficulty in passing urine, and later on they can have some complications. Now, it's very important to take the proper history. Once upon a time, enlarged prostate was very simple because patients came only with that problem. But now it has become complex. Why? Because the science has advanced so much, the options are many, medications are many, and last but not the least, patients come with multiple diseases. 30 years back, patient only came with enlarged prostate. Now they come with hypertension, who are on treatment, they come after bypass, they come after CVA, that is a coronary artery disease problem, or a cerebrovascular accident. So they come with multiple problems, and last but not the least, diabetes also. So we have to take each and every patient's history into consideration, and then only we can think of possibly giving solutions. Now, as far as prostate is concerned, a proper history has to be taken, all the comorbidities have to be considered, what are the symptoms, because there are some diseases which mimic enlarged prostate. So it's always good to take a proper history. Then we have a nice classification called as International Prostatic Symptom Score. We have a quantification of how bad the symptoms are. We ask the patient's detailed history, and then we have a certain score. If this is the score, then it can be managed with some lifestyle modification. In case there is something, a slightly higher score, they will require medication, and in severe cases it may come to surgery also. So in general, enlarged prostate is a problem of the elderly, and it can easily be tackled. Now, as far as surgery is concerned, Sagar Hospital was the first to have started laser prostate in the state of Karnataka. We did way back in 12-13 years back, we started doing laser prostates, and we are quite adept at it. We have had various kinds of laser. Now, to give you a small brief history of what is enlarged prostate, in the West, in America especially, when transurethral resection, that is across the urethra, pass a telescope and shave off the prostate, came initially, it was a big thing. We do it routinely here, and it is still a good standard treatment. But when it first came, the media went gaga over it, because earlier the treatment essentially was cutting open the patient and removing the prostate. Now suddenly you have an endoscopic procedure, so it became a big event. So there was one senator who was supposed to come to one place to give during his campaign talks, to give a talk on his why his candidature should be considered for election. So he had also enlarged prostate problem, so they contacted the local urologist. Now that particular place did not have an airstrip, so he had come down by train. So in those days, the urologist got angry when his campaign managers told him, can you consider doing his surgery? He will come in the morning and he will go in the evening by the returning train. Can you finish off his surgery in between? So the urologist got very angry and said, I can operate in between two legs, I cannot operate between two trains. Now today's era, it's come to such a situation that we could think of doing laser prostate in between two trains. You have a patient, we do surgery, we can do the surgery in the morning for small to moderate glands, operate on the patient under a type of anesthesia called as pudendal anesthesia, wherein the patient is conscious. We operate, and immediately after surgery fill the patient's bladder with saline and make him pee. If he pees, wonderful, he goes home in the evening and he can carry the train back to his native place. So that's why I said he can get the surgery done in between two trains, which was a taboo once upon a time. Now there are other complications also. So we have to tailor the treatment to a particular patient, and that is one big advantage, where proper history, sensible investigations, medications, or the complications that happen that we have to require surgery for the prostate.